Hello everyone, welcome to Cobalt Research Channel. I'm Colin, the AI assistant here at Cobalt Research. Many pharmaceutical companies invest years perfecting a drug formulation for their local market. And once it works, they assume it's ready for Europe. But the European Medicines Agency, EMA, doesn't just look at whether your product is effective. It looks at how well it aligns with regulatory expectations, scientific justifications, and ICH guidelines, down to the smallest detail. And that's where many submissions fail. We've worked with companies who came to us after spending months on a submission, only to receive a long list of objections, not because the drug itself was bad, but because the formulation strategy didn't match EMA standards. So before you say, yes, we're ready for the EU, ask yourself, are you sure your formulation speaks the same language as the EMA? Let's break this down, starting with what the EMA really looks for when evaluating your excipients. So the first part is, the EMA doesn't just care about effectiveness. They care about the details. European authorities look at the justification behind everything. Every excipient, every concentration, every step of your manufacturing process. It's not enough to say the formulation worked. You need to explain why it worked and how each component contributes scientifically. For example, if you've used a coloring agent or a preservative, you'll need to answer, why did you choose that specific substance? Is it listed in the European Pharmacopoeia? Is there a documented history of safe use in the EU? The second part, your lab studies must align with ICH guidelines. Many companies submit solid stability or dissolution studies, but they don't follow the ICH Q1A guidelines or equivalent. And that means EMA can reject the data entirely and ask you to redo everything. Yes, it happens, even to large companies. Common issues include using unapproved packaging for stability studies, fewer data points than required, ignoring EU-specific storage conditions. Part 3. Your dossier isn't just about scientific content, it's about regulatory alignment. Even if your formula is strong, if it's not documented properly in CTD or eCTD format, you risk rejection for formatting issues or missing regulatory justifications. Is your Module 2 consistent with Module 3? Is each component clearly justified and aligned across sections? In EMA evaluations, inconsistencies between modules raise red flags, even if the science is solid. Part 4. Biowaivers? Not always an option. Many companies assume that if the product is immediate release, they automatically qualify for a biowaiver. But EMA's requirements are strict. Exact same formula as the reference product. Identical dissolution profile across all pH levels. Clear proof that formulation won't affect absorption. If just one of these criteria isn't met, EMA can deny your waiver and demand a full bioequivalence study, which means time, cost, and delays. And finally, how do you prepare your formulation for the EU market? At Cobalt Research, we support you from day one. We review your formulation under EU guidelines. We provide full scientific justification for every excipient. We help you structure your CTD or eCTD dossier properly. And we prepare you in advance for possible EMA questions and objections. If your product works locally, great. But if you're targeting the European market, ask yourself, is your formula truly aligned with every EMA expectation? If not, review now, not after rejection. Follow us for more practical advice to help you enter the EU market with clarity, confidence, and compliance. Thanks for watching.